Hi, everyone. Welcome to Breaking the Silence, a podcast produced by Angels Protection, Inc., where we amplify the voices that challenge inequity, advance healing, and reimagine leadership in systems that shape our health and well being. I'm your host, Makaila Davis, founder and chairwoman of Angels Protection, Inc. And in today's episode is a part of our Men in Medicine series where we spotlight physicians whose leadership extends beyond clinical experience, men who are advancing innovation, education, and compassionate care within modern healthcare systems. This series exists because representation in medicine matters, because who practices medicine influence how patients experience care, and because leadership in healthcare must be grounded not only in expertise, but in humanity, access, and responsibility. Emergency medicine, in particular, represents one of the most critical front lines in healthcare. It is where uncertainty meets urgency, and it's where clinicians are called to make life saving decisions in moments where it's measured in seconds, not minutes. And today's guest understands that responsibility deeply. Dr. Kingsley Boateng is a board-certified emergency medicine physician and ultrasound specialist whose work bridges clinical care, medical education, and digital learning. He currently serves as the ultrasound director at Stony Brook Hospital, University Hospital, and as a clinical assistant professor of emergency medicine, where he trains the next generation of physicians while advancing the use of point-of-care ultrasound in emergency medicine. He also completed his emergency medicine residency at Stony Brook University Hospital in 2022, followed by a fellowship in emergency ultrasound at Northwell Health North Shore University Hospital in 2023. He earned his Doctor of Medicine from New York Medical College in 2019 and is board certified by the American Board of Emergency Medicine. His journey into emergency medicine began during his third year clinical rotations, where he discovered a deep connection to the fast-paced, unpredictable nature of emergency department. Emergency medicine demands physicians who are adaptable, decisive, and prepared to care for patients experiencing some of the most vulnerable moments of their lives. For him, the challenge became purpose. A major focus of his clinical and academic work centers on point of care ultrasound, a powerful diagnostic tool that allows physicians to visualize conditions in real time at the bedside, improving diagnostic speed, accuracy, and patient outcomes. Beyond the hospital walls, he's also helping reshape how medical education is shared. He leverages social media as an educational platform, delivering high yield case based emergency medicine, teaching to medical trainees and early career clinicians across the country. In doing so, he's expanding access to practical clinical reasoning, ultrasound training, and real world insights into emergency medicine, helping democratize medical knowledge in ways that traditional classrooms alone cannot. His work reflects a new generation of physician leadership, one that understands that medicine is not just practiced in hospitals, but shaped across communities, classrooms, and digital platforms. And today we are honored to welcome you, Dr. Kingsley, to Breaking the Science podcast.
How are we doing?
So good, so good. So I just kind of wanted to start by asking what initially inspired you to pursue medicine, and when did you realize emergency medicine was the specialty that truly fit you?
So it's kind of funny. My father was a computer engineer. So from a young age, I thought, hey, I'm going to go to school, I'm going to be an engineer. I'm going to do exactly what my dad did. I remember sitting in a calculus 3 class in undergrad, and I was like, I can't do this. Like, this is just not really doing it for me. Like, it's not speaking my language, it's not jiving with me. And I remember taking that time to really sit down and say, like, hey, what do I really want to do? At that time, I'd actually been doing some bench research at Moffitt Cancer Center in Tampa. And my PI, my investigator, was a doctor, he was an oncologist. And he said, hey, do you want to like shadow one of my friends who's an orthopedic oncologist? I was like, that sounds really cool. So I remember doing that and leaving and being like, whoa, 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 this really had a connection to me. And then it started forcing me to remember some of the things that I had grown up and had seen that made me kind of like trigger, like, hey, maybe medicine might be it for me. My grandmother, who spent all her life in Ghana, when she got to about the age of 72, really started having some knee issues. My parents did their best. They brought her over to America, and she actually got bilateral knee surgery. And I remember prior to that surgery that her arthritis had gotten so bad that she could barely sleep. I remember just hearing her like knees grinding just from simple movements, and just I could see the grimace in her face and how much pain she was in. She had surgery, she did really well. And I just remember her just one day, I remember her just sleeping peacefully, just comfortably. She wasn't able to do a backflip or play basketball or anything like that, but she just looked comfortable. And I just thought about how much that doctor had done for my grandmother's life and her well-being. And I was like, hey, is there any way that I could participate in that? And that was one of the triggers as like, you know what, it really reminded me from my childhood. And from that moment, I was like, hey, let me pursue medicine with all I got.
No, I love that. So, really it was that experience with your grandmother that, triggered you into where you are today, um, which you're helping so many people. not just, from being in the hospital itself, but also as a professor, which is huge. Which we'll get into that in a little bit. But I also wanted to ask too, so during your training, was there a moment with the patient that reinforced that you were exactly where you were meant to be?
It actually happens multiple times, but I remember one specific case. I had this 90-year-old woman. She came into our ED with excruciating abdominal pain. I noticed that her blood pressure was a little bit high, her heart rate was a little bit fast, and I was like, something about this just does not seem right. So we have a couple different alerts. One of the things I started thinking about in my head was that maybe something's going on with her aorta. I remember we got her to CT scan as quick as we possibly could. We got the results back that she essentially had an aneurysm of her aorta that had ruptured. And I remember talking to her like, hey, we really need to get the vascular surgeons on board. We got to get surgery as soon as possible, or you might not be able to make it. And I remember her saying, I am 90 years old. I've lived a good life. All I want is my family at bedside. And I
Mm.
remember like coordinating those calls because some of her family was like a couple hours away, and I made like this 7-way FaceTime on my own personal work phone, and she was looking at her grandchildren, her nieces, her nephews, all from my phone. She's like, I didn't even know you could do this with with the phone, and I just remember being like, wow, like you get so caught up in the actual medicine that sometimes you forget that connection. Like my ability just to simply give her a FaceTime, a 7-way FaceTime was life changing for her. She was so content with the fact that this might be the way that she goes out, but she got to do it with her own autonomy, got to do it in her own fashion, in her own style. And then after she passed, I remember the family coming and they were just so thankful and they wrote me a letter and they're like, we just are so happy that you're the doctor taking care of her in those last moments of her life and that you were able to even think about her having a FaceTime conversation and things like that and not trying to push her to go get surgery and all kind of stuff. So we really focused on her comfort, her just overall, like just her mental and making sure that she got to go out the way that she wanted to go out without trying to force anything onto her. So I remember being like, like that was one of the biggest moments like during my training.
No, and I think that's really important too, like autonomy, right? And I think when it comes to like clinical healthcare roles, sometimes I think those folks forget that and try to, would have pushed for surgery or all these other interventions, and she was like, I just want to talk to my family. That's it. I'm 90 and I'm aware. So, and her being the driver of that and you being able to give her that gift is a wonderful thing. Um, so I also kind of wanted to touch on too, you serve as ultrasound director at Stony Brook University Hospital. So for listeners who may not be familiar, can you explain what point of care ultrasound is and why it has become such an important tool in emergency medicine?
Yeah. So, I mean, I think a lot of people are familiar with ultrasound from the perspective of, hey, you're pregnant. Let's figure out what the baby looks like. But it's a tool that we use clinically so often to be able to quickly differentiate different types of pathology without having to get formal studies like a CAT scan that might take time and you might need IV access. I can quickly pull the machine at bedside and be able to differentiate why you came in with chest pain or shortness of breath. I could see different things that might point me towards, hey, is this possibly pneumonia? Is this possibly something like a collapsed lung? Do you potentially have like a pulmonary embolism? And I can do that so quickly and be able to guide my interventions that traditionally would have taken a lot longer to get that information. So point of care ultrasound has honestly become one of those things that I kind of say, hey, after I do my physical exam, I'm doing my ultrasound. And it's kind of been a tool that I use really often. And I try to get the residents who are learning underneath me to feel really comfortable with it because I feel like as we go further along in the future, it's just going to continue to be a bigger and bigger facet of how we perform emergency medicine.
No, I love that. And I was not quite aware that you could use that for so many things. I knew it was for like, hey, here's the gift for the baby. It's your time, boy or girl. But no, I think that's really a beautiful thing. So you can kind of, especially in emergency medicine, um, handle that quickly because people are coming in and out and they're in so much pain and they don't know really what's going on. So I think that's a wonderful thing. And I also wanted to ask too, so what excites you most about the future of ultrasound in clinical practice?
It's got to be the applications are just like things we never thought about we're using it for. So, like even my shift yesterday, a patient came in with some blurred vision in one of their eyes, and I was able to take the ultrasound and take a look at their eye and be able to diagnose them with a vitreous hemorrhage, which is basically a different. It's kind of some eye pathology that it's basically like a little bit of blood in the back of the eye, or it's kind of how you can kind of think about it. It's the easiest way. And maybe a decade or so ago, I don't think anyone would have thought that you use an ultrasound for an eye. Back then, it was barely like, oh, can we use it for the lungs? And we're just continuing to see more and more applications of it that I think, a decade from now, I can't even imagine what we're going to be using it for.
No, I love that. So, like, what I'm hearing is that there, like you're saying, is the application is how that will move forward even throughout time coming up.
Yeah,
And progression.
because it's becoming more ubiquitous. So I feel like maybe, a decade or so ago, the only people who were using ultrasound were people who did an actual fellowship in it. And it's become so part of the residency curriculum where our residents are finishing residency and they feel so comfortable with the ultrasound machine that I think that because there's such a larger collective of emergency medicine physicians who feel comfortable with ultrasound, that we're going to continue to push the boundaries of what we can use it for. We're going to continue to see, hey, maybe I can use this to diagnose this. Maybe I can use it to diagnose that. Maybe I'll be better at this procedure, and maybe decrease my complication rates by using ultrasound. So I certainly think that as we are having more clinicians and more physicians who are comfortable with this modality, we're just going to continue to use it for more and better things.
No, I love that. And as we're talking about training and teaching, I kind of want to touch on too, in addition to practicing medicine, you're also a clinical assistant professor. So, what do you enjoy most about teaching medical trainees?
That light bulb that goes off. Oh man, like I love when they ask me a question and I'm like, you know what? I hope you got some time because we're really about to dive into this. Because one of the things that I love is when they're able to connect kind of like textbook ideas with an actual patient, and I feel like it creates a better foundation. I remember having a patient with a resident, and I said, "Hey, let's start insulin on this patient," and they looked at me kind of dumbfounded, like the person came with pancreatitis. Why are we starting insulin? And then we had to break down the pathology of when they have really high triglyceride levels, this can cause pancreatitis. And from that day, I was like, you know what? Like, that actually was part of the spinoff of why I actually created the TikTok and to be able to try to create these videos for other people who are in medicine or are just medicine interested to try to disseminate this information out. So being able to participate in resident conference, be able to give lectures, be able to go overseas and work with people from other countries who might be doing something different. So I'm learning from them, they're learning from me. So the actual assistant professor role has really been awesome to be able to just branch outside of just the ED and be able to take what we learned in residency and kind of spread that to residents at other programs and be able to give talks and things like that. So it's been an awesome experience.
Right. And I think that's really important too, right? Like you're touching on, like, going to conferences, speaking to folks that are in other countries and, the networking components. And really love when you touched on too, like on that light bulb that goes off when you're teaching
That's
and being able
awesome.
to pour into the next generation, so they can be more innovative in their practices, that they go on to do. And then I also kind of wanted to ask too, so how do you prepare young physicians to navigate both the clinical and emotional realities of emergency medicine?
What's a tough one? A lot of times I'll just ask them their why. And I know it kind of sounds like this cliche, like, oh, very soap opera type question, but I feel like medicine has progressed to a place where we're kind of like decentralizing just the medicine part. And I'm kind of happy about that. There was this old thought process of, hey, medicine's going to drag you through the dirt. Like, you're not going to have a life. You're not allowed to smile. You have to just put your head down and march through it. And I feel like the new generation of physicians has said, no, we're not going to subscribe to that. We're going to still live our lives. We're going to have social medias. We're going to be traveling. We're going to be having families. We're going to do all of it at the same time because we're not going to just centralize medicine. Doesn't mean that we want patient care to be on the back burner or on the back seat, but it's one of those things where, like, when you are better as a human being, you will be better for your patients. And I feel like that old school like abuse of like, hey, this hierarchy that needs to be stuck to and you can't kind of wiggle out of it. I think this new generation is like, they're doing a really good job about that. So from that perspective, I like to always talk to my residents, and we have these mentorships type things about like, hey, what do you do outside of here? Like, I know you're working on your notes, I know you're trying to see another patient, but at the end of the day, like patients are always going to come to the ED. We're open 24/7. You got to take care of yourself, right? Because at the end of the day, like all you have is your mental, your health, and that's got to be priority. And then the better you're able to take care of that, you'll be able to kind of pour into your patients, be able to pour into the world of medicine, the better you are for, and the better you'll be for it.
No, I agree with that. And I think also too, like you said, this next generation of doctors are different and not subscribing to that. And that has been a common theme. Like I'm a member of the Student National Medical Association and I do work with them and I have seen that that they are, not going for that. And it's important to, do things that you like to do, because then you're better for your patients as well when you're not just like, oh, okay, I'm just a medical doctor. I'm just doing this every day and I'm here and I'm working and, nobody look at me. Don't look at me. I'm just a doctor. I'm just putting in prescriptions. And then I'm leaving
Exactly.
and going to bed and do
Yeah.
it again,
Mhm.
Monday through Friday. I might take a
Exactly.
day on Saturday too, just to pick up a shift because it's my whole life. And you don't want to do that. So,
No, not at all.
traveling is good, and,
Sure.
having a life. So I really do appreciate how you touched on that. That's really important. Um, and then kind of I wanted to talk about too is one of the unique aspects of your work is using social media as an educational platform. So what motivated you to start sharing emergency medicine teaching online?
So to be perfectly honest, it's probably my wife. My wife was the TikTok person, and I didn't even really get on TikTok. I'm not really a social media savvy kind of person. And I remember telling her about the that patient that we had to give insulin to for pancreatitis, and she was like, "That's actually pretty cool." So my wife is in medicine, and she's like, "That's kind of a weird presentation. Like, do you think you possibly want to make a video and put that on TikTok?" And I was like, I don't know. I remember trying doing a couple dry runs. She was trying to give me like, oh, you should do it. Like you need a better punchline. You need this. And I was like, this doesn't feel organic to me. And then one day she's like, you know what? I'm gonna take all the pressure off. Just make the video how you think you want to make the video. And I remember just talking to the camera, uploaded it, and it did pretty good. And I was like, hey, maybe people actually like this stuff. So 10 videos later, I'm realizing like I'm getting more engagement, more followers. I was like, actually, you know what? This is something I'm actually enjoying. I feel like it's a way to maybe there might be someone who resonates the way that with the way that my brain works and how I think of certain pathologies and how I think of certain workups, and that might make them feel like, hey, the next time I take care of a patient with that exact pathology, maybe I might be able to do that for them. Or when they're sitting on that board exam, they're like, hey, I remember that TikTok video about how do I treat this, and I'm just hoping that I'm able to provide somebody with something, and ultimately this leads to just better patient care overall.
And I think that's really important too. And that's another way of learning for folks, like if they're not able to get it straight from the textbook. Like, okay, this makes sense. I've seen it on TikTok. Because who doesn't love TikTok? I'm always on TikTok.
Exactly.
And also too, so what responsibility do physicians have when sharing medical education on public platforms?
It's okay. So that's an interesting one because I feel that when you are in this position, you have a duty, you have an obligation that the information that you're providing is factual. But I also think that there is a flair that you want to add to it because at the end of the day, if there's not that flair, they can simply just Google it or ChatGPT it. What
Mm.
are you bringing to it that makes it stick? But you can't bring so much of a flair where you're losing the actual, the fidelity of the information. So I think you have to, our responsibility is that we have to provide accurate information. Obviously, if you're using, any kind of like patient stories or encounters, or you want to de-identify patients and make sure that we're still complying with HIPAA and things like that. But I think the big thing is like, hey, when you're providing information, keep it true, keep it real, keep it factual. But also sometimes you might have to do a disclaimer like, hey, I know this might not be the gold standard answer, but this is how I do it. This is more anecdotal. So as long as you provide those caveats and people are able to take that, I think you're okay. But you certainly have to make sure that if you're doing something that's not textbook, make sure people are aware that it's anecdotal and it's a little bit off the cuff. But at the end of the day, I think people are able to take that information, kind of, synthesize it for themselves and say like, hey, this is what I want to take out of it. This is what I don't want to take out of it. And if it was able to help them in any way, shape, or form, I think you've done your job.
I agree. And always putting a disclaimer out. That's really important. Um, and then what I wanted to touch on too, so what role do emerging technologies such as AI, imagining advancements in digital education, play in shaping the next generation of healthcare?
So from a clinical perspective, the biggest push in AI we've seen right now is probably your notes. So how we interact with our EHR or our EMR, our electronic medical record, is the biggest thing I've seen. So we now have the ability to have like these pocket scribes. So you go into a room, you press record, it listens to the conversation, you tell them what the workup is, and then by the time you get back to your desk, it's kind of formulated a note. With that being said, we have seen some kind of like pullbacks from some of these AIs where initially they were offering, okay, so I heard the conversation. Maybe you want to order this, that, and that. And when that happens, it gets a little bit tricky because we're now having AI suggesting how to do the workup,
Mm,
but who's liable for that? Right? Like if AI told me that I should order this test and order that, and there's something goes wrong, I'm still the physician at hand that made the ultimate decision, right? But does the person on the back end of the AI who created the AI, are they a part of any of this liability? So there's still some weird things that we have to figure out from that perspective when as it pertains to AI. And then AI in terms of like from an educational perspective, we're seeing a lot of it in terms of trying to aid in the lack of hands-on training that some people might get. So depending on what residency you're at, and some of the you might be in more of a rural location, you might not be able to do certain procedures at the frequency that you'd like to feel comfortable with. So the concept of, hey, can we have like these simulations? Can we have AI try to create these scenarios and you being able to do certain things and answer questions and interact with, tablets and touch screens and all that kind of stuff? Does that possibly act as good enough for the procedure? We don't know yet because it's really been a big push as of recent, but we'll see. I mean, it's sometimes like, hey, I'm not, these are certain procedures, what we call them halo procedures, that are basically high acuity and low occurrence kind of thing. Like we just don't do them often. Can AI kind of help? Is it better to have something than nothing?
mm.
But we still, the jury's still out, so we'll see.
That makes sense. And that's interesting. I didn't know that there were those like pocket scribes that you guys had, so that's new. Um, but that's really interesting, and I'm interested to see where this will go over the next 5 to 10 years with AI. And kind of like you said too, like okay, if we're using the pocket scribe, but if AI is making certain decisions about what I should order, right? It's a suggestion, but do I, as a doctor, follow through with that, or I make my own recommendations? So that's a good point. And also, too, what advice would you give to students who are considering emergency medicine but may feel intimidated by its intensity?
It's not like that all the time. Emergency medicine has a spectrum, and honestly, over the past decade or so, we're kind of seeing a shift where we still take care of really sick patients, but we still do a lot of bread and butter medicine just because our outpatient colleagues are inundated, right? They are packed to the brim. Like you try to say, like, hey, let me try to get you an outpatient appointment, and they're coming back with months from now, right? So a lot of things we're seeing in the ED is really managing kind of chronic-y type of stuff or things that we typically just have you follow up with your primary care doctor. But you call your primary care doctor and they're like, hey, I know you've had a cough for the past week, but I can't see you for another 3 months. So you come to the emergency department. Um, so I think the big thing is that we have to understand if EM is your thing, that there's that slice of excitement, but there's also going to be a lot of, I wouldn't call it downtime, but there's going to be a lot of just normal medicine that you're performing as well. So to think that you're going to be on 24/7 is not accurate. Plus, there's different settings, right? So you can always choose in a setting that you want to work at, right? So you can say, I want to work in a really rural area. You could say, I want to work in a busy city. You have the ability to work in different environments that are going to kind of jive with your lifestyle. I know people who work just locums where they're not employed by a hospital. They work for a locums company and they say, you know what, I'm going to work 5 shifts a month and the rest of the month I'm off. Right. There's people who, they're like, you know what, I'm trying to make as much money as possible. I'm working 20 days a month. So it depends on what you're looking for. You can find an environment that will fit what you like to do. At the end of the day, if there is that intimidation factor and it's simply just from a, hey, am I going to like this thing? There's always a sub I. If it's from an intimidation factor, if you feel like, hey, I'm concerned that this type of medicine just won't be my type of medicine, you're never going to know until you jump into it. I came into medical school thinking that I knew what I wanted to do. I was like, oh, I'm going to be, an orthopedic doctor because that's the kind of doctor that took care of my grandmother. I was in a surgery that was supposed to last for an hour. I was there for 7 hours. I said,
Mm.
this can never happen again. I can't be in a surgery to go 7 hours. So you're really never going to know until you hop in, right? So always keep an open mind, be willing to learn, and just remember, like, patients come first. And it's just the type of medicine that you can, kind of sustain in your lifestyle that is going to allow you to make sure that you're to take patients to come first.
No, I appreciate that. And that kind of touches on too. So, what habits or mindset shifts helped you succeed during medical school residency and fellowship?
It's not that serious. That was probably the biggest thing that helped me. it's just not that serious. I remember I had a pretty big test coming up. It was like an anatomy test, and my wife's sister was getting married, and I was like, I can't go to the wedding. Like, I got a big test coming up next week, and she's like, figure it out. So I remember, okay, all right. So we were driving down. I'm studying. We have a good time at the wedding. I come back, and it's honestly one of the best grades I ever had.
Mm.
And I was like, oh, it's interesting. Like, I'm used to studying from the moment I wake up to going to sleep. I get these kind of grades. And this time, my studying was a little bit haphazard. And I realized what was happening is that I was more focused. I was saying I had this amount of time to accomplish something, learn this amount of material, because I know I have an obligation afterwards. And when I started to change my mindset of like, hey, everything isn't like everything is serious, but everything's really not that serious. Like, the wedding's important. Playing basketball with your friends is important. Cooking dinner and going to the gym is important. Not just studying is important. And once you're able to kind of create this, like, this mindset and this frame of mind of where, like, hey, I need to give everything its due diligence that I feel is important to me, I think you're able to kind of like set yourself up for success, right? Because I've seen people just burn out. They're studying from 8 a.m. to 10 p.m. And it's just a law of diminishing returns at a certain point. So at the end of the day, it's serious, but it ain't that serious. And I think that mentality was probably what carried me through, undergrad, medical school, residency, through fellowship. Like, I want to be the best I can be, but at the end of the day, like, other things like fill my cup up, right? And if you're not having those other things pour into you, you're gonna be pretty empty at the end of it.
Yeah, and studying for 8 to 10 hours is dangerous and not pouring into your cup. That is not a hobby. School and studying is not a hobby, people. I had to learn that. I
Yeah.
had to learn that for myself. I'm a current
Mm-hmm.
PhD student and it is brutal. And I had to learn that. Kayla, you
Yep.
cannot be doing that 24/7 in that book. You need
You
to
can
put,
have periods of lock-in. Don't get me
yeah,
wrong. You want to lock
definitely
in
need to
from
do
time to
that,
time,
but
but it's not sustainable.
it's not a hobby. Studying school is not a hobby. No. Playing, like you said, playing basketball with friends, going out, going to the movies, spending time with family. Those are hobbies. Those are things that fill your cup. So really important to have that balance. So also too, what continues to keep you motivated in medicine today?
We had some right answers, some wrong answers, some answers I feel like is right to me, but money's certainly one of the things that keep me motivated. So I say that from the perspective of, hey, I had a lot of colleagues, I had a lot of friends growing up, people in undergrad. They were like, hey, I can't go into medicine because that takes too long to make the money, and they ended up going to become a pharmacist. And I have a good buddy of mine, super smart guy. I said, hey, I think you'd be a great doctor. Went to be a pharmacist, literally practiced for like 2 months, and then went back to med school. Like, literally went to med school after 2 months of being a pharmacist. He's about to finish residency soon. But I remember that, and I was like, man, like, there's something to be said about like sometimes the slow and steady and knowing what the end of it, what it looks like, is an amazing thing. Like, we have seen what this type of career path can do for you in terms of changing the fortunes for yourself, of friends, because it's not just about the money. It's sometimes the fact that I'm able to provide family members with a level of access to care that traditionally they might not have access to. I'm able to call colleagues and say, like, hey, I have a family member with this type of labs. I'm concerned for this. Like, what do you think might be going on? Like, to be able just to pocket dial somebody without having to just do random Googles or have to wait 3 months for an appointment is an amazing access that you get that sometimes I think we take for granted. The ability to comfortably provide for my family and my two children and be able to live in the area that I want to live in, like, those are all awesome things that medicine provides. We are in a place now where medicine isn't quite as you're more viewed as an employee. Back then, it was more so like you are the physical walking businessman, right? People would, throw a shingle up and then have a practice and boom. We're not quite there anymore. It's more so like, hey, I work for this company, I work for this hospital, I work for this entity, but they still pay you really well, right? And I think as long as you're able to say like, hey, I'm able to balance that, you're good. The other things that I say keep me going is knowing that the work I do is important, right? Like, I never want to leave a shift and be like, man, I gave people subpar care. And that level of pride in what I do, and I've always said, like, no matter what you do, if you're gonna be a plumber, be the best plumber, and be like, yo, I did those pipes, right? I killed that. And I want to have that level of pride. And that's what medicine does provide with me, where I'm like, hey, I really sat there, critically thought about that illness, and I provided them with that level of care. And I feel proud about that. So those are like my big things, is the fact that I'm able to provide the life that I want to for myself and my family, as well as able to provide care for patients that look like me, that sometimes don't traditionally have that initial trust with the provider that they have when they come to the ED. So when they see me, they're like, hey, I feel like I can also oftentimes see that they're just a little bit less on guard. And we're able to have more of a candid conversation. They're able to tell me things that I can kind of like socially pick up and understand the importance of, that if someone's not from a similar background, they might not be able to take that into consideration when providing the care for you. Or how do we come up with a proper disposition? How do we give you advice on how to eat and do things? So we can't just say, hey, get rid of every fried food you have. Sometimes we got to figure out how we're going to make some little adjustments. How we're going to make that plate look a little bit greener. So there's certainly element of just me being able to take me and bring it into medicine, and my interests and background and things like that. That's awesome.
No, and I really like how you started to talk to like, being paid and compensated.
Talk about it.
I advocate for that 24/7. It's important that, if you have especially as we're talking about doctorates, if you have a doctorate and you got that terminal degree, you deserve to be compensated because it was a lot of work, to get that degree. And yes, doctors are smarter than the rest of the population because they did that work. I seen a post on TikTok that was like, "Oh, you think you're smarter because you got a degree?" Well, yeah. Yeah. If I got a bachelor's degree, I'm smarter than the person that has the associate degree. That's why I went to go get the bachelor so I could make a little bit more money. Now, if I have a master's degree, of course I'm smarter than a person that just has a bachelor's. It could be a bachelor's in anything. I could
Yes.
be your manager now because I have the master's degree. Now, if I go for a doctorate, MD, JD, PhD, any doctorate that says I am a doctor, yes, I'm smarter than the rest of the population that didn't do that. So, yeah,
Mm-hmm.
the doctor deserves to be compensated for payment
Talk
because you
about
did
it.
the work. So it's really important. It's about if you do the work, you deserve to be paid and be paid in your pay scale, not outside of that.
Yes.
So,
Yes.
you
Serious.
know, and it's really important because that's another equity gap that isn't talked about too much, having those doctorate degrees and not being paid what you should be paying for.
Yep.
So
Yep. Yep.
yeah, really important. And then also, like you said too, being able to provide for your family is really important, and having that level of access, because again, being a doctor, you are a part of the one percenters. There's only so many people that are able to make it that far and then get to a point where they can also, be a director in a leadership role and teach, at the same time. So having
Yeah.
that power is really important, and that level to be able to help family and friends and lean on other colleagues, like you said, being able to um, not having to wait for appointments, because that's another thing. So it really does change the trajectory for your intermediate family with your wife, with your kids, with cousins, aunties, uncles,
Yeah.
grandparents, friends, um, and that support. So it really does make the difference. And if you know you're going to be a doctor, just wait it out. This is the process. And I think a lot of times that's what people, especially now in society, it's so everything's like fast food. I want it now. I need to have it now. I need payment now. I can't wait, you know?
Mhm.
And if you know that this is the process, there's no other way to become a doctor besides this one pathway. And this is it. You need these certain amount of courses. You need to have, especially now too, like really it's so hard. It's like they really want you to start in high school to know that you're a doctor, that you're going to do
Yeah.
it, and gain
Yep.
all your volunteer experience and all these other things that you need to build your package up. So
Exactly.
it's it's just really important if you know that's something that you want to do that and wait it out because the reward will be greater at the end. And like you said, now you're able to live in the house that you want to live in, the neighborhood that you want to live in because you've seen it through. So, and I know your younger self is so proud and would never think that, you would just be to where you are now because it's a lot of work, but you did it. and you stayed
Especially,
true.
I didn't see a doctor, right? So I think sometimes it's easier to get to that finish line when you've seen someone do it and you're like, okay, so I know that if I do this and do that, I'll be able to do that in the future. Oh, it's worth it. Let me just do it. I didn't quite see that, right? Don't get me wrong. My father, my mother, they're amazing. They came from Ghana when they're in the early 20s. They provided an amazing life for me. So by no means am I saying, there isn't, there isn't value to that story, but at the same time, being able to see doctors, like if I have young children who are coming up, I do a lot of volunteer work, and they're able to see like, hey, you never want things to be fully materialistic, but like, hey, drive a nice car, wear nice clothes. It shows that, hey, you can do this. There's nothing about me intrinsically that is more special or anything like that makes me, hey, he's supposed to be a doctor, you're not supposed to be. And the life you're able to provide just by, putting that one foot in front of the other is really doable. It's really possible.
Yeah, and also too, representation matters. Being able to see somebody that looks like you that's doing the work. And, it's hard, like you said, when you haven't seen someone that looks like you doing it. And now being able to be that for the young kids growing up is really important. And it's okay to like nice things. There is nothing wrong with that, and especially now, in the day and age that we live in. Um, so I also just wanted to say also too, thank you so much for your commitment to patient care, medical education, and innovation in emergency medicine. Your work reminds us that medicine is not only about diagnosing disease, but it's also about showing up for people during moments of fear, uncertainty, and vulnerability. Through your leadership in ultrasound education, physician training, and digital learning, you are helping ensure that knowledge continues to expand and that the next generation of physicians are equipped to deliver care with both precision and compassion. So, to our listeners, if today's conversation resonated with you, stay connected with Breaking the Silence and Angels Protection Inc. as we continue elevating voices that are transforming healthcare, education, and community systems. And I also wanted to ask the $1 million question: how can folks stay connected to you with the work you do?
All right. So you can certainly follow me on TikTok. So you'll find me at Dr. Kingboat MD. Always, I try to reply to every comment possible. If you're interested in things like shadowing and all that kind of stuff, I'm super open. So if you find a way to connect with me on TikTok, I can give you all the information needed. We try to go to conferences as much as possible. This year, I will be at AMEC from SNMA, which is going to be in Pittsburgh. So maybe you might see me there. So.
So, guys, please stay connected with him and take advantage of, connected with him on social media. And if you are a part of the SNMA or going to be there, please also see him there and take advantage of that too, because we see him on the podcast right now.
Yeah.
Um, so I also wanted to say, just always remember, guys, science protects systems, not people. So let's keep breaking it together and like, comment, and subscribe. See you guys later. Bye.
Thank you so much for having me.